going to show you how to do an ace bandage wrap. And here's my ace bandage, and when you unwrap it, to wrap the arm, you're going to unwrap it, unroll it this way instead of like this. Makes it a little easier. Now the first one I'm going to show you is just a little circular wrap, and we're going to wrap from distal to proximal, so it kind of pushes the blood flow up towards the heart. So this is a little circular wrap to hold it, and then next I go up like I'm going to do a spiral up, but the next one I come down and it just holds it a little bit better than the spiral, and then the next one goes up and the next one goes down and the next one goes up. And if you'll look closely, you can see that it looks kind of like a braid going up the arm. And then after you're finished, you want to tape it. Throw those little clips away that come with the ace bandage. Tape it in the hospital so the patient doesn't, lay on it or something. It doesn't come loose. And then you want to check their extremities to make sure that you haven't wrapped it too tight. So this is your reverse spiral right here.
Ta-da!
Okay, I'm going to explain to you how to do the figure 8 on the ace wrapping. And I'll have my patient hold his hand up and hold his fingers out like that. I'm going to fold this over like this, and I'm going to put the folded part down, because if the germs come in, I want them to come in under just one fold instead of more than that. So I'm going to do the circular wrap around the hand, and then I'm going to do a little figure 8 here to stabilize it. I'm going to come up and just stabilize it a little bit more. And then depending on where your problem is, you can keep going up and down like a figure 8, or if your problem is down more here, you can open it up and continue with your reverse spiral, which is what we're going to do for this patient here. And then that just gives a little more stabilization here, and then you can put your tape here. And that's what your figure 8 looks like for your hand. You want to leave your fingers out and your thumb out. I'm going to show you how to do a figure 8 ace wrap around the foot, and we want to leave the heel out. So we're going to start at the distal area and do a circular wrap around the foot to hold it, and then we're going to come up and go down like a figure 8. That's all there is to it. You don't want to pull your ace bandage too tight. And then when you're done with that, you can do a little circular wrap or go back down and tape it off. So that's your figure 8 around the foot. I'm going to show you how to do an ace wrap around a stump. And this is a simulated stump. It's not a real one. So instead of starting at the far part, because there's nothing to make your ace wrap stay, we're going to start proximally this time. And I'm going to wrap it in a circular way to make it hold, and then I'm going to bring it down, and the next one I'm going to bring it up, and then the next one comes down, the next one goes up, and the next one goes down, and you can look at that and it looks like a reverse spiral here, and if my ace bandage was long enough it would go over the end, which it's not, but that's the part that you want the most wrapped. So you want to start circular up here and then do your reverse spiral going down until you get over the end. And that's wrapping a stump.
Now see if you can answer these questions.